Welcome to the deep dive. Today, we're going to invite you to sort of peel back the layers on something really fundamental, something we often just take for granted.
Our own bodies, right.
Exactly. That deep breath you just took,
Oh.
or maybe that little ache you felt earlier. Understanding the incredible design just beneath the surface can really change how you perceive these everyday things.
It absolutely can. And our mission today is a deep dive into the chest, or the thorax, as it's technically known. We're aiming to pull out the key insights from, well, a quick review of its anatomy, how it develops, which is fascinating, and its clinical significance.
Think of it as a shortcut, maybe. A way to get properly informed about this vital part of you, uncover some surprising facts, and, really get why it matters.
Precisely. So where do we start? The basics.
Yeah, let's ground ourselves. The chest, it's the upper part of your trunk, right? Sandwiched between the neck and the abdomen.
Mm-hmm.
And it's basically a bony cage
Mm-hmm.
formed by the sternum, your breastbone, then the ribs, and the thoracic vertebrae in your spine.
And its main job, its primary job.
Protection, keeping those incredibly important organs safe, like the heart and the lungs. It's quite the piece of natural engineering when you think about it.
It really is. And what's amazing is watching how that intricate structure actually comes together. This whole space, the thoracic cavity, starts developing incredibly early.
How early are we talking?
Around the 3rd week of gestation, it comes from something called the intraembryonic colon. Now, don't worry about the term.
Okay.
Think of it as the body's first tiny internal sort of bubble of space. It starts off U-shaped.
A U-shape.
Yeah, a U-shaped cavity. And then, with amazing precision, it gradually molds itself into the pleural cavities, that's where the lungs will go, and the pericardial cavity, which forms right in the middle to surround the heart.
Wow. Okay. So this one little U-shaped thing basically directs the formation of all these critical separate spaces. That's pretty incredible engineering for an embryo.
It is.
And what about the diaphragm? The muscle we need for every single breath.
Yeah.
How does that fit into this early development?
Good question. It really shows how meticulously the body is built. The diaphragm itself is, well, it's a kind of patchwork.
Patchwork.
Yeah, it forms from 4 distinct parts that have to grow and fuse together early on. Pieces coming from the front, the back, even from the developing gut tube. It's like a complex jigsaw.
Okay.
And that intricate process is exactly why sometimes things can go slightly wrong, like with a congenital diaphragmatic hernia, if those pieces don't fuse perfectly. It really highlights the body's precision, but also its vulnerabilities during development.
Right. Developmental precision and vulnerability. Okay, so we go from these tiny beginnings to this complex structure. Now, fast forward. Once it's all built, how do doctors, or even just us being curious, navigate this from the outside? What are the key landmarks on the surface?
Yeah, this brings us to the body's own sort of built-in GPS. These surface landmarks are absolutely vital for everything from a basic checkup to, complex procedures.
And is there one that's particularly useful?
Definitely. One of the most useful, maybe the most useful, is the sternal angle, also called the angle of Louis. You can actually feel it yourself.
How?
Run your finger down the top part of your breastbone, the manubrium. You'll feel a sort of horizontal ridge where it meets the main body of the sternum. That's it.
Yeah. Yeah, I think I feel it. Okay, so what's the big deal? Why is that spot so important?
Yeah.
Seems like just a bump.
Well, here's the amazing part. It's not just a bump. It's like a major intersection point internally. So many critical structures line up perfectly with it.
Like what?
Okay, so the sternal angle is exactly at the level of the second costal cartilage. That's where your second rib attaches.
Okay.
It also marks the T4-T5 intervertebral disc, so the space between the 4th and 5th thoracic vertebrae in your spine.
Right back to the spine.
And, maybe most critically, it's precisely where your windpipe bifurcates. Splits into the 2 main bronchi going to each lung. And it also marks the upper limit of the pericardial sac, the bag around your heart. So think about it. If a doctor needs to quickly find a specific vertebra, or know where your airway divides, or estimate the top of the heart's covering.
They just find that one ridge on the sternum.
Exactly. It's like a universal internal coordinate. Makes things much more precise, much less guesswork.
That's genuinely useful. Not just a bump, like you said, but a multi-purpose internal signpost.
Yep.
An anatomical nexus point. So what else? Any other key landmarks we should know?
Well, there's the nipple. In men, it's typically around the 4th intercostal space, but it's quite variable. So clinically, it's not considered super reliable for pinpointing things.
Okay, so not the nipple. What else?
A more consistent one is the midclavicular line. Just imagine a vertical line dropping straight down from the middle of your collarbone, your clavicle.
Right.
That line is really useful. It helps locate the apex beat of the heart, usually in the fifth intercostal space along that line, and it helps define the edges, the borders of the lungs.
It's amazing how these external points can map out so much inside. But what about the ribs themselves, the actual framework? How do they fit into this picture?
Right, the ribs. Essential components. And it's interesting, some are easier to feel than others. The first rib, actually quite hard to palpate properly. It's tucked right under the collarbone.
Okay.
Then you have the floating ribs, numbers 11 and 12. They don't connect to the sternum at all at the front.
Which makes them
A bit more exposed, unfortunately, so they're more vulnerable to fractures. Just for context, the seventh rib's cartilage is the last one to attach directly to the sternum.
got it. And that little pointy bit at the very bottom of the sternum.
Ah, the xiphoid process.
Yes.
That small projection marks the level of the T9 vertebra, and it's roughly the upper limit of your liver.
Useful marker, too.
Yeah.
And in terms of injuries, what gets broken most often?
Well, for rib fractures, it's usually the middle ribs, say ribs 4 through 9. They're the longest and relatively exposed.
Makes sense.
And in things like car accidents, especially steering wheel impacts, the sternum itself is actually the most commonly fractured bone in the chest.
Ouch. Okay, so we've got the protective cage, its external map. Let's dive inside now. Talk about the organs it's protecting. Lungs and pleura first.
Absolutely. The lungs are just incredible organs, perfectly designed. The right lung has 3 lobes, superior, middle, and inferior, divided by 2 fissures, the oblique and horizontal.
Oh, really?
But the left lung only has 2 lobes, superior and inferior, with just 1 oblique fissure,
Wide difference.
to make space. The heart sits mostly on the left side, so the left lung is slightly smaller, has that little notch for it. It's a perfect example of form following function, the body adapting.
Efficiency. And you mentioned the hilum.
Right, the hilum. Think of it as the root or the main entrance-exit point on each lung. It's where the bronchi, the pulmonary arteries, the veins, nerves, lymphatics all go in and out, like a busy airport terminal for the lung.
Okay. Now, I heard something interesting about if you inhale something by accident, like a peanut or something, does it tend to go into one lung more than the other?
Yes, that's a really important clinical point. It absolutely does.
Why?
It's down to anatomy. The right main bronchus, the tube branching off the trachea to the right lung, is shorter, it's wider, and it angles downwards more vertically than the left one.
Ah, so it's like a more direct path.
Exactly. So if you aspirate something, accidentally inhale it, it's statistically much more likely to end up lodging in the right main bronchus or further down in the right lung.
That is fascinating.
Yeah.
And clinically very important, I imagine.
Hugely important. Knowing that helps doctors figure out where to look first if someone comes in having choked on something.
Right. So immediate medical attention obviously needed.
Well, absolutely. Airway obstruction is serious. Sudden coughing, choking, wheezing, difficulty breathing, all signs. Knowing the right side bias just helps guide the immediate response, like with a bronchoscope.
Okay. You mentioned the pleura earlier. The lining.
Yes, the pleura. It's a serous membrane, very thin, very slick. It's actually 2 layers. The visceral pleura sticks right onto the lung surface itself.
Like cling film.
Kind of, yeah.
Okay.
And then the parietal pleura lines the inside of the chest wall, the diaphragm, the mediastinum.
And between them?
That's the pleural cavity, or pleural space. It normally contains just a tiny amount of serous fluid, just enough to lubricate.
So they slide.
Precisely. It allows the lungs to expand and contract smoothly, almost without friction during breathing. Absolutely crucial design.
Okay, so frictionless movement thanks to the pleura. How does the actual breathing process work then, mechanically?
Well, breathing or respiration, it's all about changes in pressure inside the chest, the intrathoracic pressure.
Okay.
When you breathe in, inhale, your diaphragm contracts and flattens, and your external intercostal muscles pull your ribs up and out.
Making the chest bigger.
Exactly. Increases the volume inside the chest cavity. Think of it like pulling back the plunger on a syringe. This bigger volume creates negative pressure relative to the outside air.
Which sucks air in.
Draws air right into the lungs. Simple physics, but beautifully executed.
And breathing out.
Expiration, breathing out is usually passive, at least at rest. Your muscles relax, and the natural elastic recoil of the lungs and the chest wall just pushes the air back out.
Passive recoil. Elegant. Okay, from the rhythm of air, let's shift to the engine. The heart, tucked away in there.
The heart, a 4-chambered muscular pump, Just a marvel of efficiency. Also has its own protective sac, the pericardium,
Right?
very simply put. The right side pumps deoxygenated blood to the lungs to get oxygenated. The left side pumps that freshly oxygenated blood out to the rest of your body.
And the pacemaker, where does the beat start?
That's in the right atrium. There's a little cluster of specialized cells called the SA node, the sinoatrial node. That's the heart's natural pacemaker, initiating each electrical impulse, each beat.
Okay, and the pericardium, that sac you mentioned. What's its specific job, beyond just protection?
Well, protection is key, but it's a tough fibrous sac that also helps anchor the heart in position within the chest. It stops it overfilling, too.
So it has layers, too, like the pleura.
Yes, similar idea. An outer tough fibrous layer, and then an inner serous pericardium, which itself has 2 layers, parietal and visceral, with a potential space between them.
The pericardial cavity.
Right. And normally just a tiny bit of lubricating fluid in there. But if too much fluid builds up, say, from infection or inflammation,
That's bad.
very bad, it's called a pericardial effusion. And if it gets severe, it can lead to something called cardiac tamponade.
Tamponade.
Yeah, it means the fluid pressure builds up so much it literally squeezes the heart, preventing it from filling properly and pumping effectively. It's a true medical emergency. Shows how finely balanced things are.
Wow, yeah, stark reminder. And in the heart muscle itself, how's it designed for its massive job?
Well, the whole pumping action is the cardiac cycle,
Oh,
and the design reflects the workload. Take the left ventricle, for instance.
the one pumping blood to the body.
Exactly. It has the thickest, most muscular wall of all 4 chambers, because it has to generate enough force to push blood against the high pressure of the entire systemic circulation all the way to your brain and your toes.
Needs extra muscle power.
Definitely. And critically, we have to mention the coronary arteries. These are the small blood vessels on the heart muscle, supplying it with oxygenated blood.
Right, feeding the heart itself.
Yes, and sadly, these are a very common site for atherosclerosis. That's the buildup of fatty plaques.
Which narrows the arteries?
Narrows them, restricts blood flow. And this can lead to angina, or worse, a myocardial infarction, a heart attack. And cardiovascular disease, often stemming from this, is tragically the leading cause of death worldwide.
A really sobering statistic. Puts the heart's importance in perspective. Okay, quickly, what about the other tubes running through the chest? The esophagus and trachea.
Right, essential plumbing too. The esophagus is the muscular tube connecting your throat, your pharynx, down to your stomach. It's your food pipe, basically. It passes through the diaphragm around the T10 vertebral level.
Got it. And the trachea.
That's your windpipe, airway.
Mm-hmm.
Extends down from the larynx, your voice box. You know those C-shaped rings of cartilage?
Yeah, you can feel them sometimes.
They're crucial. They keep the trachea propped open so it doesn't collapse when you breathe. And remember how it bifurcates, splits into the bronchi?
Yeah, you said that lines up with the sternal angle.
Exactly. That split point, called the carina, is right there at the T4, T5 level, same as the sternal angle, another connection.
Okay, so we've got the basic structure, the development, the key players inside. Let's maybe wrap up with some quick clinical correlations, the why it matters in a very practical health sense.
Sounds good. Some key takeaways. Chest pain, for example. Scary symptom. But it's important to know the most common cause is actually musculoskeletal pain, not always the heart, which is reassuring for many.
Good to know. What about coughing up blood?
That's called hemoptysis. The most frequent cause is often bronchitis, inflammation of the airways. But, and this is critical, dentist, lung cancer must always be ruled out, especially if the person smokes. You can't miss that.
Right. And speaking of lung cancer, does it tend to occur in specific parts of the lung?
Yes, statistically, the most common site for lung cancer to originate is in the upper lobes of the lungs.
Upper lobes. Okay. And common heart defects, or that fluid around the lungs.
Well, the most common congenital heart defect one you're born with often turns out to be a ventricular septal defect, or VSD. That's basically a hole in the wall between the 2 lower chambers, the ventricles.
A VSD.
And for pleural effusion, that fluid building up around the lungs we talked about earlier, the most common type is what's called a transudative effusion, and the most frequent cause of that is congestive heart failure.
Okay. Wow. So we've really journeyed through the chest, haven't we, from its intricate development to navigating those landmarks, exploring the vital organs inside. It's just amazing how much complexity is packed into that space.
It truly is. And hopefully understanding some of these details might just, subtly change how you perceive your own body day to day.
Like recognizing the mechanics when you breathe, or appreciating that your body has this built-in GPS with things like the sternal angle. It gives you a new lens, doesn't it?
Absolutely. A new appreciation for the design.
So maybe here's a final thought for you to take away. Given how these seemingly simple points on the outside, like the sternal angle, act as crucial markers for so many different internal structures, what does that tell you about how interconnected and, efficient your body's design really is? And how might understanding these internal maps actually empower you? Maybe help you be a bit more attuned to your own physical well-being and just appreciate the amazing machinery constantly at work inside you. Something to think about.